In this COVID care center, one of the largest in Mumbai, these doctors gather in a huddle every hour to assess bed availability. All 2,000 beds in the facility are now occupied. Like in a game of chess, they constantly have to move patients who are out of danger from ICU beds and take in those who need critical care. Dr. Sapna Rao and her team have been kept on their toes as a second wave of infections peaks in the city. All dentists by profession, they came together when there was a severe shortage of doctors in the field to treat COVID patients. So far, they have successfully treated and cured over 14,000 patients.
Fighting through this pandemic has been a challenge in which we have learnt so much, from 32 teeth what we used to see, and from a gum surgery what we call in a normal term, to handling something of COVID has been a total challenging process.
Dr. Neelam Andrade, who leads the dentists, says this has been an especially difficult time for them. She says it's hard to stay hopeful with death looming around, but they've chosen to stay on and do their duty as medical practitioners.
Somebody has to be there to save lives. And if we are there and we are here since 1 year, we are the most experienced. If at this point of time we run away from the field and a new person comes, they may not be able to handle it that well. So when we get messages from the relatives, they phone us, they send us messages of thank you for saving their relatives, and their relatives are back home. It gives us more encouragement that yes, let us save as many as we can.
The second wave hit Mumbai city in the first week of April. In less than 15 days, there were nearly 50,000 active COVID cases in the city. The entire healthcare system was overwhelmed with the new surge, and the emotional toll was severe for those serving on the front line of this pandemic.
I have had patient relatives coming and crying outside our gate and saying, milne do, last time milne do, and I don't know how to tell them that, see, you are at a risk by going in, I can't love you. That is the time when you break down, within, but you can't show it.
The second wave of COVID-19 has been brutal for India. Mumbai city has been under a strict lockdown for over 3 weeks now, and frontline workers like Dr. Neelam and her team are working non-stop to slow down the spread of the virus.
The situation is still quite grim on the ground. In the last 48 hours, 15 dead bodies were brought to this crematorium from the nearby COVID hospitals. Dr. Neelam warns that a second wave is imminent for a large city like Mumbai.
If we expect another wave, or as it is happening around the world, we need to be prepared with more oxygenated beds. We need to have a higher supply of ventilators, class 1 ventilators available to us. This is a huge task. If you don't have a system in place, the operation cannot be conducted and it can flop, it can collapse.
A mask and a social distance is all that we are asking for. So if people can maybe take that seriously, if you put down a mask and you're still going to spit on a road and you're still going to have the mask hanging on your chin, nothing is going to help. Whether we work 24/7 or whether we are on our toes with a racing mind, nothing will help.
Determined to uphold their oath to preserve the health and welfare of their fellow Indians, these COVID warriors continue to bravely face the ongoing pandemic storm, armed with hope and a strong sense of duty. Pracheta Sharma, CGTN, Mumbai.